and we'll try to keep this session as an interactive session. Let's not make it boring by just me and me only teaching. So we can discuss it, whatever things you want to discuss. So I'm open for any question and answers related to the topic. All of you can raise your hands also, and you can put down your questions in the chat box also. Dr. Liwanshi, I think you will be there to coordinate.
Yes, ma'am, I have.
Okay. Even your video is not on. You don't want to?
No.
Okay. So I think we can start. I think the screen is visible to everyone.
Yes, ma'am.
Okay. So hello everyone and welcome to today's session for facial aesthetics and fillers. And thank you everyone for taking out time out of your busy practices. Please, all of you, can you please
Zoom में डाल दिए होगे फोटो इसलिए.
Hello, everyone. Please mute yourselves so that Dr. Mridu, ma'am, can speak.
Okay, so I'm audible, Dr. Liwanshi. I'm visible
Yeah,
also.
Yeah, ma'am,
Okay.
you're audible and
I
visible.
can't see myself. That's why I thought I am visible or not. I don't know. Chalo, anyway, thank you everyone for joining here today. Out of your taking time out of your busy practices, and thank you, Dr. Liwanshi and Dentaflix, for giving me this opportunity to speak on my favorite topic, that is the facial aesthetics and the fillers. So, just giving a brief introduction. Can anyone tell me why is my camera not visible to me? Is there some setting I have to do, or is it like that only?
Ma'am, you are visible.
I am not visible to myself. That's why I was asking. Is there any setting? Yeah. I got it. Okay. So just to give a brief introduction about myself, I did my PG in orthodontics from this Agra University, and then I did PG DCC, that is the postgraduate diploma in clinical cosmetology, from Wiesbaden University, Germany, and then I did a smile makeover course from New York, and I did a permanent makeup course from Italy, Messina University, and then I did a 3 years diploma in naturopathy and yoga from Delhi itself. And I've spent almost a decade in facial aesthetics with a focus on creating the beautiful faces. And more so, I am also into empowering the doctors across the globe in so that they should include facial aesthetics in their practices, so that it can help you take your horizon to a next level as a dentist. So today we'll be covering the following topics. The key points will be the skin structure and anatomy, the skin aging and the wrinkles formation, the treatments against wrinkles, the types of fillers, the indications and the contraindications. So again, I'm telling you, if anyone has any problem, any questions related to that topic, you're most welcome to question me anytime in between also, so that we can have it as a detailed discussion. And if you do not want to talk in between, you can put your questions in the chat box. And again, we are there to answer you in the last part of our webinar. So all of you being dentists here, you must have seen that when you are working on the teeth of the patients, you must be noticing that the soft tissue structures also play an important role. Because whenever there are negative facial features, it gives an impact on the psyche of the patient. It gives a negative impact. And when there are positive features, that enhances the confidence of the patient. Suppose a young female of 45 age is coming to you for the smile designing, and you have given beautiful pearly whites to her. But what if her surrounding tissue structures are not good, like her corners of the mouth are drooping down, or her lips have thinned down, because of which her smile is being hampered. So being a dentist, we have to give a holistic approach so that we can give something extra to the patient when the patient is leaving from your clinic, so that you stand at an edge apart from the dentist surrounding you. So coming to all these topics one by one. First of all, the skin structure and anatomy. So all of you, we all know that the skin is composed of different layers. That is the epidermis, the dermis, the hypodermis. Epidermis is the superficial layer of the keratinized epithelial cells. And this is the layer which helps as a barrier between us, our inner bodies, and the environment. And it being a barrier, at the same time, it also acts as a semi-permeable membrane because it absorbs moisture. It locks in the moisture inside it. And at the same time, when it is locking in the moisture from outside, it is also preventing the water inside your body to move out of your body. So we all know that our body is composed of so much liquid, that is the blood, the other liquid. So that liquid is contained inside our bodies because the epidermis, that is the outermost layer of the skin, is not letting it outside. So it's covering it as a dual function. Then we have the dermis, that brings the resistance and elasticity to the skin because it has got many proteins like elastin, the collagen, which help in maintaining the elasticity of the skin. And with age, these proteins, that is the elastin and the collagen, they tend to break down. They tend to get dentings in them, so they tend to break down, and that is how we move towards the wrinkle formation, that is towards the aging. Then there is the hypodermis that ensures the junction between the skin and the subcutaneous tissues. Then all the other layers, that is the muscular layer, the superficial fat pad layer, the deep fat pad layer, then the periosteum, all these layers are lying below the hypodermis. So whenever we are injecting Botox, we are always injecting in the muscular layer, which is lying below the hypodermis. Below the hypodermis is a superficial fat pad, and below the superficial fat pad is the muscular layer. And into that muscular layer, we always inject Botox, and into the superficial fat pad or the dermis or the deep fat pad or the periosteum, we inject fillers. I think those of you who have already joined my webinar, they must be knowing the difference between the Botox and the fillers and which layer to be injected for which product. So the skin aging and the wrinkles formation. So the aging is a continuous process, we cannot change it. And the aging is a combination of the three factors, that is the alteration. Anybody there? Any question? Please tell me. Okay. So the aging is because of a combination of three factors. That is the alteration of the bony structure. We all know that as we grow older, the orbital cavities, they tend to increase in size. The nasal cavities, they also tend to increase in size. And this chin, there is a deposition, and this chin comes forward, and there is a loss in the vertical dimensions. So this is all the changes in the bony structure. Then there is also a volume loss from the fat compartment, because these fat compartments which are lying in the younger age at this specific position, they tend to migrate down. They tend to fall down because of the gravity, because of the repeated muscular action, because of the so many factors, that our fat pads which in the younger age lie here, they tend to come down. And then the skin quality decreases because of the loss of elasticity, because of the decrease in the production of collagen, elastin, because of the denting in the collagen and the elastin. And also there is a molecule which is known as a hyaluronic acid molecule in our skin, and this hyaluronic acid molecule decreases with age. And this molecule has a very good water retention capacity, and that is why when there is a decrease in the hyaluronic acid content, the water retention in our skin decreases, and that is why the glow in our skin decreases. Okay, Then skin aging, the physiological modifications. So while aging, we can observe in the skin a slowing down of the skin cell proliferation. The newer cells do not proliferate much. Then there is a decrease in the hydration rate, we already discussed, because of the hyaluronic acid decrease. Then there is a modification of the composition of the extracellular matrix, that is the denting of the collagen and the elastin. So this is a picture showing how the orbital cavities size increases, how the piriform area aperture increases. So this is all because of the volume loss in the bony areas. Then this is the volume loss from the fat compartments. The fat compartments, they tend to come down and they also decrease in the size. And because when they come down, when the fat pads come down, so instead of a increased width on this area in the middle third, the increase of the width occurs in this area. And this also occurs due to the masseteric hypertrophy, because with age, this masseter which is lying here, this masseter tends to broaden. So when this masseter tends to broaden, the lower third of the face tends to broaden. So there are various factors of the skin aging, that is the genetic factors, we get it from our parents. Then there is photo aging, those who have a lot of field duty, who are out in the sun. So they are always advised to wear a good SPF sunscreen, because in India, it is a hot climate, in North India especially. So people should wear at least 30 to 50 SPF sunscreen, because sun is the major culprit for formation of our wrinkles. And this happens more in the fairer skin. In the fairer skin, because the melanin content is less. So this UV rays which come from the skin, they hit directly the collagen and the elastin, and they cause the indentation of the collagen and the elastin. I can see a hand raising. Do you have any question, doctor? Please tell me. Yes, please. Do you have a question? Dr. Liwanshi, there is a question.
Yes, ma'am.
Yeah, please tell the participant to ask.
Please speak 399. Hello. Ma'am, please proceed. If anyone wants to ask any doubt, please write in the chat box. Thank
Yeah.
you.
Okay. So then there is those people who are more in the sun, they tend to get more wrinkles, because in dark colored people there is melanin. So whenever there is a ultraviolet exposure, that melanin rushes to your skin and it absorbs the UV rays, and it doesn't let the UV rays to enter deeper inside into your dermis, so that the collagen and the elastin remain protected. But in fairer skin, because the melanin is less, so there is more indentation and more formation of the wrinkles in the fairer skins. Then also there are free radical damages because of the toxins, because of the smoke, because of the alcohol, and because of the pollutants in our daily life. Then also there is some chronic illnesses due to which aging occurs early. Then there are some malnutritional chances also, because people who do not take a lot of nutritious food, they also tend to age earlier than the people who are taking a well-nutritious diet. Then the rapid weight loss also leads to aging processes, and whenever there is a permanent stress, that also leads to an earlier aging. Aging is a continuous process which cannot be stopped in anyone. But these factors, if they are present, they lead to a quick process of aging. So stress is one thing that affects all the body parts, that even affects your hair. Whenever we are in a stress, you must have noticed that the hair fall also increases rapidly. So as far as possible, we should convince our patients to remain free from stress, which is really not possible in today's life. Then how do the wrinkles and folds formation occur? This is, I told you, because of the loss of the hyaluronic acid, because of the decrease in the water content, and because of the indentation of the collagen and elastin, the wrinkles start appearing. And then there is a scale which is known as Glasgow photo aging scale. So as we age, our wrinkles are, first of all, our dynamic lines start appearing. Dynamic lines means those lines which come on action, like when we are frowning or when we are smiling or when we are raising our eyebrows. So in the starting, those dynamic lines start appearing, and as we grow maturer, these dynamic lines, they tend to become static. I think someone is asking for a link. Just let me, yes. Okay. So all of these dynamic lines, they tend to convert into static lines. And as we grow maturer, more maturer, these static lines like the tear trough, then this thing, nasolabial fold, the marionette lines, all these start appearing. And as we have already talked many times, that only on the dynamic lines will our Botox or the botulinum toxin work. And in the dynamic lines, in the static lines, only our filler will work, because filler is like a gel. So when it is introduced into any fold, that gel will go inside the fold, and that will lead to absorption of the water. And when it absorbs water, that line or that valley slowly decreases.
अब जब निकलेगा ना तो बस ऐसे तो बस पकड़ने मिलेगी, बस मिलेगी भिंडी।
Please mute yourself. Please mute yourself. So who are the participants? Who are our patients? So among all the patients, we can separate three major categories. First of all,
Dr. Ritu has doubt.
yeah, please, Dr. Ritu, tell me what is the question?
Hello, Dr. Ritu.
I think by mistake she has done it.
Yeah. Please continue.
No problem. So in the young women who are less than 30, what they tend to follow as anti-aging. They use aesthetic medicine to change their appearance. They would like to go for any antioxidant for eating, or they would like to go for any facials, or they would like to go for any creams to apply. So that is their main priority. So they target a beauty ideal. They want to look they have some idol in their distinct mind. So they want to look and behave like that beauty ideal. And then use of the fillers, if they are going for fillers, they use it for lips enhancement, or for raising the cheekbones, or for face contouring, or for reshaping. That is their main priority. Then women from 40 to 60, they are the aesthetic medicine. They use aesthetic medicine to look younger, and fillers are used for deep and medium wrinkles treatment. So deep and medium wrinkle treatment means the treatment of the tear trough, the nasolabial fold, or the marionette lines, the lines which run from the corner of our mouth that make us look sad. Then men from 40 to 60, that is an emergent category of customers calling for prompt action. Like both men and women in the age of 40 to 60, they have this thing in them that I want to look younger in any way. I am not accepting that I am growing older. So there is a huge variety of such people who want to get these treatment done. So we have ready clientele in our clinic, because all those patients who are coming for the dental treatment, they are your prospective patient for the cosmetic thing. In today's world, who doesn't want to look more beautiful? And believe me, the person who is coming along with the patient is also one of your client. So accordingly, you have to talk to the patient as well as their associates who are coming with them. So anyone in your waiting area can be your client for the beautification process. And then men and women from 40 to 60, they wish to combine between the changing appearance and looking younger. So what are the treatments against wrinkles that we will discuss in detail today? So we are going to discuss the fillers. Botox we have already discussed many times. Still you have any questions, you can ask me in the Q&A session. And then coming to the fillers in detail. So filler is a safe, predictable and forgiving tool to treat the sign of aging. Safe if you are using it in the proper hands, then it is safe. If it is not being used safely, then it is not safe. You have to take particular precautions while using the filler, so that it should not go into any artery. And there are some other precautions also that have to be used. So if you are using those protocols, if you're using those precautions, then it is definitely a very safe treatment. Then it is predictable, because the moment you inject filler, the patient will start seeing the result. What we do in our practices is, when we inject fillers, we always inject on one side of the face. And as I'm going on injecting, I give a mirror, handheld mirror to the patients, and ask them to see the difference from one side to the other side. Whenever I'm injecting, I always give a mirror in the hand, that after giving just 2 or 3 shots, you can ask the patient to see the difference. So once the patient will, you can keep a hand like this and ask the patient to see one side which is treated, and then keep the hand like this and ask the patient to see the non-treated side. The patient will definitely find the difference if you have put the filler in a right plane, in a right technique. Plus, it is a forgiving tool to treat the sign of aging, because we have the antidote available for it. Most of the fillers today which we are using have hyaluronic acid in them, and they have we have hyaluronidase, which is an antidote. So if by any chance your filler goes wrong, then you have an antidote that you can inject, hyaluronidase. Then the types of filler, just asking again, am I audible and I'm visible also?
Yes, ma'am, you are audible and visible.
Okay. Then the types of fillers, there are permanent fillers also, and there are semi-permanent also, and there are temporary fillers also. Permanent fillers are the fillers which are silicone-based products, and they remain inside your body permanently. The silicone-based products are there. Then there is suspension of solid particles in a carrier like Articol, Artiplast, Dermalife, Dermadeep. All these are permanent fillers, which all these, the names which are written, they are the brand names. Then there are new synthetic polymers like Newfill, Aquamate. They all have different products like PLLA, PLA. So all those are permanent fillers. What the permanent fillers do is, they go inside your body, they remain inside your body, and they stimulate the collagen inside your body. So if you have injected the filler inside, your body will tend to produce collagen around it. So when that collagen is produced, that collagen which is being produced, that will start lifting your appearance of the skin, that will start removing the wrinkles. But there are always drawbacks to these permanent fillers, and I do not really prefer to use permanent fillers, because there is no possible remodeling. Once you have put the fillers, there will not be any remodeling, and plus there is a risk of activation of macrophages, and there is a risk of sudden appearance of granuloma, and also there is a risk of migration of products to the migration of the product particles to some other areas where you do not want the filler to go. And the only thing how we can bring back the result which we have brought, and we do not want to get that result, then we have to switch to a course of steroids, or we have to surgically excise that area. So that is why I never prefer to perform the permanent fillers. I always want to go for the degradable fillers, that is the hyaluronic acid filler or the collagen fillers. Okay. Hello. हाँ शुक्र है ऊपर आ जाओ. So then there are resorbable products. The resorbable products are natural polymers like collagen and the hyaluronic acid. The advantages of this is, these are highly biocompatible. They do not have any side effects, and we have the midterm treatment with the possibility to come back to initial aspect if the patient is not satisfied. There are many times that the patient is not satisfied. I do not want this product. I'm feeling my face heavy, or I was looking better the way earlier I was. So we are lucky that we have an antidote called hyaluronidase, and this hyaluronidase is also used in the oral surgery. We are using it for the oral trismus also. So in combination with the Kenacort injection. So that is how it is used. But in case you don't want to use it for the fillers, we mix it with the normal saline and the lignocaine, and then we inject it, and then as soon as we injected the hyaluronic acid which has been injected, that effect goes away. That effect is washed away. So the collagen-based products are Zyderm, Zyplast. Then there are the main drawbacks is collagen is a protein from animal origin. So allergic test is necessary before injection. And there is also a risk of virus uh, uh, because of the, if there is a risk of virus because of the prion transmission. So the most commonly used fillers are the hyaluronic acid fillers. The hyaluronic acid filler, I told you again, hyaluronic acid is a naturally occurring polysaccharide which is present in our skins. And it is found in all the living cells, including the human body. It is present in your eyes, it is present in your knees, and it forms aggregates with other sugars and proteins in the extracellular matrix. And hyaluronic acid used for filler manufacturing, and it might be animal or the biofermentation origin. It is mostly obtained from a bacteria that is the Streptomyces. Then we have the various types of the fillers, that is the company Galderma, which is giving the Restylane boosters, Restylane, Perlane, Amerval, lots of products. Then there is Juvederm range, that is the Voluma, Volift, Volbella, Volite. There are various types of products depending on the consistency. The thicker the product, the thicker it will go onto your skin. The thinner the product, it will remain superficial. So what are the indications which you want to cover? Why do we use fillers? So we use fillers to reverse the signs of aging. We use fillers for facial volumizing. Wherever there is a loss of volume, we tend to increase the volume because suppose the volume has decreased in the cheeks. So we want to give it a fuller look. So then we use facial fillers. Then for the facial contouring, for the jawline or for the augie curve. So we use it for the facial contouring, and then we also use it for the rejuvenation of the hands, of the skin and the face. Whenever some patients come to you who complained of the loss of structure in the hands, they do not like their thin hands, so they want little wetty look of the glowy look of the hands. So there again you can inject hyaluronic acid fillers, and those people who are having a very dry skin, even those patients can be injected hyaluronic acid fillers, because this is going to absorb water around it and it will improve the elasticity and will give a very good glow to your skin. So what are the indications in the mid-face? Coming to the mid-face, we have the eyes, the cheeks, the nose, and the nasolabial folds. In the eyes, the infraorbital tear trough depression because of the volume redistribution. Here, the fat pads in the younger age, which were present here, they tend to migrate down. So because of that, the tear trough appears, and these tear troughs can be easily filled with your gel-like fillers, that is the hyaluronic acid fillers. And then there are periorbital lines, the crow's feet, due to the decreased tone of the orbicularis oculi muscle. So if a younger woman is coming to you for the treatment of the crow's feet, we always try to prescribe the Botox or the botulinum toxin for the dynamic lines. But in an older female, in a maturer female, where the dynamic lines have become static now, so there we prescribe the botulinum toxin as well as the fillers, because in the older females or the males, both in combination, that is the Botox and the fillers, that is going to give you the best result. Then in some people, the darker or the tired eyes appearance is because of the loss of the volume between the orbicularis oculi muscle and overlying skin of the lower eyelid. In those cases also, the fillers can do wonders, because the blackness or the dark color is because of the hollowness. And when you're going to fill the hollowness, this will automatically improve the appearance of the dark circles. Then there is a cheek fat redistribution downwards, creating nasolabial fold. All these fat pads, they come to tend down because of the gravity. And when they come to tend down, the nasolabial fold also increases. So we try to decrease the nasolabial fold. And whenever the patient wants to come to you for the treatment of the nasolabial fold, so instead of injecting directly into the nasolabial fold, we try to inject in this area, that is the cheekbone area, that is the zygomatic bone area, because whenever you will inject into the zygomatic bone area, this whole area will get lifted. And when this whole area will tend to get lifted, the nasolabial fold automatically decreases. And still, if the patient is more concerned about the nasolabial fold particularly, then you can, in the last injection, you can go and fill up the nasolabial folds also directly. But most of the times, first of all, whenever the patient is coming to you for the nasolabial folds, we try to correct it by injecting in this area. So treatment in aesthetics is always it is not a solo treatment, so it has to be combination with the other parts of the face also. But like if the patient is coming from this area, so we have to counsel the patient accordingly. Ki ma'am or sir, treating this area will not help you much because it is suspended like a hammock from this area. So I have to treat this area, because only after I treat this area, then this nasolabial will improve. And this is, we talked about the mid face. We also treat the nose, but nose is the last indication to treat, because this is this area, that is the supratrochlear, supraorbital artery, and the ophthalmic artery, and the infraorbital artery. So this area is a little danger zone. So we try not to do the nose in our initial days of practice. So once you are, you have a good hands holding on your fillers in the other areas, so then you can switch over to nose also. So in the mid face, these are the areas which we have covered: periorbital area, tear trough, cheek augmentation, nose, and the nasolabial folds. And in the upper third of the face, we normally again do not use fillers unless and until there is a hollowness in the temple. Then we use fillers, or there is a concavity in the forehead. So whenever there is a concavity in the forehead, then also we can go and fill up that concavity. And but in the this thing nose wala area, center glabular area, we tend to avoid the usage of the fillers because of this being a high risk area. Then coming to the lower face. So the lower face, there is a loss of definition of the vermilion border and the loss of lip volume. There is a downturn of the oral commissures. There is a redistribution of the subcutaneous fat and loss of the skin support around the chin pad. There is a loss of jawline definition and appearance of a horizontal chin crease. This chin crease. So all of us, we know that whenever the patients in our late 40s or 50s or 60s are coming, the lower third of the lower third of the face has already decreased. So if we divide our face into 3 equal parts, ideally this portion, that is the hairline to the glabella, this portion should be equal to the glabella to the nasea, to this area, base of the nose, and from the base of the nose to the pogonian or the lower part of the chin, these should be 3 equal parts. But with age, what happens is, because of the loss of the vertical dimensions, we being dentists, we understand it very well. Because of the loss of the vertical dimension, this lower third tends to decrease down. So when this lower third has decreased down, we can always increase the lower third of the face so as to give it as equal appearance to upper third and the middle third by injecting the filler in this area below the pogonian to increase the lengthening of the chin. That will give a lengthening appearance to the chin. And in some cases, there is a loss of projection. When you see in the side profile, when there is a loss of projection, if you keep a pencil like this, these 2 points should meet like this, the nose and the chin. So if you are doing like this and the chin is retruded, so if there is a loss of, like in class 2 cases, where the upper jaw, that is the maxilla, is growing forward, but the mandible has not grown sufficiently, that is the people who have retruded chin, they can be put the filler in this area to give it a camouflage look, so that it will appear that the chin has come forward. So that is a beautiful treatment which is given by the fillers, and it is a quick and non-invasive treatment, because many a times the patients come to us in their late 20s or 25s, when they have crossed the age of the functional appliance. Because if a child had come to us in 10 years, 12 years, and the child has a retruded jaw, we can always push forward the jaw by giving functional appliance. Me being an orthodontist, I can very well make you understand this. And in my practices, in my child orthodontics, I make it a point to give an orthodontic appliance or a functional appliance, so that the chin which is protruded, which is not growing forward, has to come forward. It should be brought forward by any functional appliance, or if we are planning to go for a fixed appliance, and if there is any hindrance, like if there is a lateral incisor present inside the upper jaw, which is not letting the lower jaw grow forward. So first of all, our aim in orthodontics is to lock out that lateral incisor which is present inside, so that it should not give a hindrance to the lower jaw to grow. So we have to correct the obstacle, any obstacle which is present, which is not letting our orthodontic treatment go well. So because our aim is to bring that chin forward, either it can be a functional appliance if the child is in a growing age, if the child has not come to his maturer age, or if there is any hindrance, but still the child is in the growing age. So we have to stop that obstacle, we have to remove that obstacle. Or if there is a crossbite which is covering, so we have to remove all those obstacles when we are doing the orthodontic treatment. And then if the age has crossed, there is no chance of bringing the chin forward, then in the maturer persons, you can always inject fillers. But the only negative thing will be that these have to be repeated, these are not permanent. So every 2 years or 1.5 years, you have to again give the filler back, because the body tries to hydrolyze the filler which we have put inside.
Hello, ma'am.
Yes.
Dr. Anand is having doubt. Please repeat about periorbital line.
Periorbital line. Yeah, periorbital line. You mean to see the tear trough or the perioral lines? Can you repeat the question? Periorbital lines or perioral lines?
Periorbital lines.
Periorbital lines are the lines which are around the eyes. We have a muscle which is known as the orbicularis oculi muscle around our eyes. So this muscle tends to lose its tonicity, and that is why the wrinkles around our eyes come. The wrinkles which appear on the side, they are known as the crow's feet, and the wrinkles which appear down, they are known as the periorbital lines. So if these lines are dynamic, then we have to treat it with the Botox, and if they have become static, then we have to treat it with the fillers. Who had asked this question? Is there any still doubt? Dr. Liwanshi?
Dr. Anand has.
Dr. Anand, please tell me if there is any doubt.
So it won't be dangerous.
Okay.
Ma'am, he is saying that it won't be dangerous.
No, unless and until you have injected in a safe plane, because there is a technique to use. There are two types of technique when we are injecting the fillers. One is with the needle, one is with the cannula. So earlier we used to do it with the cannula only, and we used to inject on the orbital rim. But because that is a little risky area, so now we have shifted altogether to the cannula. So whenever I am injecting the tear trough area, I never try to use the needle, because there is always a risk of the needle entering the orbital area into any vessel. But now because we have altogether shifted to cannula, so cannula, they have blunt tips. So they do not tend to enter into your vessel, and they do not try to cause any damage. Though there can be a damage, but if you have mastered your technique well, then there is no chance of damage. So you can easily go with that annula in the tear trough. Believe me, every day I am injecting a tear trough, every day, touch wood. So it's a very safe area, very good results. People are so happy after getting the tear trough injected. So don't worry about the risk. But you have to master the technique of the cannula for the tear trough specially. So is that clear, Dr. Anand? Dr. Liwanshi, that's clear. Should I move on?
Yeah, ma'am. Someone is having doubt.
Yeah, please tell me.
Zaki, anesthesia for periorbital area.
Not needed at all. I do not give anesthesia while injecting fillers, because most of the companies like the Allergan, the Galderma, which is providing you the fillers, they already have lidocaine in them. only the initial prick is little painful. That also can be, that pain also can be reduced after you have applied the Numbex or any numbing cream like Top Lap or the Prilox or the Numbex. So if you have to, if you have applied that cream for at least 40 to 45 minutes, and that too with a plastic covering over it, that is known as under occlusion. So that area tends to become little numb. So when you inject, the patient really doesn't feel pain. And also the one of your assistants can tap the head or tap the forehead, so that will act as a distraction mechanism, so that when you are injecting, the patient will not feel much of a pain. So really anesthesia is not needed, because earlier when we started with the fillers around 10 to 12 years back, the doctors used to give injectables like local anesthesia for the infraorbital block. They used to give the inferior alveolar block, the mental block. But there was always a risk that if at all the filler has gone into your vessel, and that filler is blocking the vessel, blocking the blood supply, and the pain which should have occurred as an alarm to you, that pain will not be there. The patient will not be able to feel any sensation that the filler is going in the wrong plane. So just to avoid that complication, we make sure that the patient is in full senses. If by chance you happen to go wrong and you don't come to know that you are going in a wrong place, immediately the patient will tell you, stop doctor, I am having a lot of pain. So that is a clear alarm to you to stop. But if you have injected an anesthesia, you will not come to know that you are going in a wrong plane. So I have never injected filler, never injected anesthesia along with the filler. So I hope that makes it, that makes some sense by not giving an anesthesia.
Yes, ma'am.
Okay. Any other question? Anybody?
Yeah. In how much time will hyaluronic acid dissolve by itself?
See, if you have injected the filler today, and if you want to inject the hyaluronic acid, hyaluronidase at the same time, it will wash off all the hyaluronic acid within minutes. And if the filler has been there from a long time, like patient ने बहुत पहले filler कराया था, around 10 years पहले कराया था, 5 years पहले कराया था, and that filler is still lying there and the patient is not liking it and the patient wants to get it dissolved, then you will inject it, and then it might take few days, like 1 or 2 days, or say sometimes a week also, to get the filler completely resolved. So if you want to plan a filler after injecting hyaluronidase, like after dissolving the old filler, we should at least wait for a week, because the hyaluronidase injection which you have given, that works at least a week. So it's always better to wait for a week before starting the next injection of the hyaluronic acid. So is there any other hand raise?
No, ma'am.
Okay. So there are various types of fillers available according to the consistency. So the thicker the filler, the deeper it will go. This is also known as the tissue tailored concept. Because if we happen to inject thicker product in the superficial area, it will lead to the formation of the lumps. And then you will have to dissolve those lumps by giving hyaluronidase. And since all of these fillers are very expensive fillers, so this will be a sheer wastage of money from your pocket, because the patient is not going to forgive you for that. Then if you are injecting very thin filler in the deeper most layer, that is onto the bone, your filler will be moved in the body. It will go to the lymph nodes, because this will act as a foreign particle and it is very small, very thin. So it will be washed off. There will not be any result. So the patient is again going to complain to you that, doctor, I cannot see any result, because you had used the thinner product and you have put it in the deeper layer. So deeper the indication, like for the deeper indications are the any area which has to be augmented, like the cheek augmentation. Here you have to inject onto the bone. Like the chin augmentation, here you have to inject onto the bone. So you will open your syringe, fix up the syringe, and then you will put onto the bone. You will have to feel the bone and then wait for at least 10 minutes, 10 seconds for aspiration. Aspirate so that there should not be any blood. And once you have aspirated properly, then you have to inject onto the bone when you are doing the cheek augmentation or the chin augmentation. So that is the deepest layer. That then you have to take the thickest product, that is the dermal. or the Restylane Perlane or the Restylane Lift. So these are the thicker products. And in case you want to use a thinner product, like if you want to use if you want to cover the nasolabial fold, if you want to inject into the nasolabial fold, then you have to use a product which is in between, which has an in between consistency, that is the medium consistency. That is, you can use Lift, or you can use this thing, or you can use this Restylane. So these are all medium consistency products. And if you have to inject into the dermis just for the superficial hydration, then you have to use very thin product like the Restylane Vital, or also known as the skin boosters, or you can also use the Allergan Volite. So that is a very thin product that is going to give a good hydration. So all those thinner products have to be used superficially, and the thicker product has to go deeper. Then this is a Hindrer model given by an author, Hindrer. So what he told, that if you draw a line from the outer canthus of the eye to the outer corner of the mouth, one diagonal line, another line at the FH plane, that is this thing, it's not FH plane, this is from the Ella tragus line, sorry. So Ella tragus line is from the corner of the nose to the external auditory meters. So if you draw these two lines, then the upper triangle, which is lying on the zygomatic bone, so that is a very safe area to inject for the cheek augmentation. So whenever you are planning to inject for the cheek, this is a very safe area. You can start practicing in your practices when a patient wants to go for the cheek augmentation, wants to get a lifter look of the skin. So you can draw these two lines and take a good quality, thicker product and inject deep onto the bone. So this is a very safe area to inject for the cheek augmentation with the hyaluronic acid fillers. Then there are various contraindications, that is, the dermal filler injectable gel should not be used in patients who have severe allergies marked by a history of anaphylaxis or history of presence of multiple allergies. Then patients with a history of allergies to gram-positive bacterial proteins, patients with a history of allergies to lidocaine. And precaution should be that the dermal filler injectable gel should not be injected into the blood vessels if there is any active inflammatory process or infection at the specific injection sites. Treatment should be deferred until the underlying process is controlled. So there are just two precautions, that it should not be going into the blood vessels. Secondly, if there is an acute infection inside the body, like the patient has just recovered from the COVID, or patient has just recovered from any dental abscess, or the patient is giving you a history, or you yourself has treated the patient for a dental abscess, do not perform the procedure at the same sitting. Give at least a gap of 7 to 10 days, because all these fillers like hyaluronic acid filler, this contains sugar inside. We talked that hyaluronic acid type is a type of sugar. So this sugar tends to absorb attract the bacteria or the viruses around it. So whenever it is attracting the germs around it, so it can again lead to the exacerbation of the infection. So we should always try to have a proper history कि पेशेंट को पहले कफ एंड कोल्ड बहुत एक्सट्रीम वाला तो नहीं रहा, कोई फीवर एक्सट्रीम तो नहीं रहा, या कोई डेंटल एब्सेस तो नहीं रहा, या पेशेंट ने रूट कैनाल तो नहीं कराया, और इवन इफ देयर आर acute acne on the skin, that is also a type of acute infection. So that again can be a hindrance to your filler treatment. So try not to do the filler treatment in such cases. And again, if there is any systemic problem like the diabetes, it should be controlled. Thyroid, the patient must be taking any medicine for that. So accordingly, whatever systemic diseases history you are taking in your dental procedures, the same history and the same protocol you have to use for the injectables also. So what are the precautions? The safety of the dermal filler for use during pregnancy in breastfeeding females or in the patients under 18 years has yet not been established. So it is at your own risk. And the safety and effectiveness of the dermal filler injectable gel for the treatment of the areas other than the facial wrinkles and the folds have not been established in controlled clinical studies, but the lip is the most wanted treatment. So everybody is doing these today. That is a different thing. It's a very common indication. Then patients who are using substances that can prolong bleeding, such as aspirin or ibuprofen, as with any injection, may experience increased bruising or bleeding at the injection site. So if any anti-inflammatory is being taken by the patient, he or she should be asked to stop it 3 or 5 days prior to that. And as with all the skin injection procedures, dermal filler should be used with caution in patients on immunosuppressive therapy or therapy used to decrease the body's immune response, as there may be an increased risk of infection. So all this we have read in our dental things also. So those of you who want to learn these procedures in detail, they can join our workshops. This June workshop is already full. We have already said no to many of the participants because this batch got full very early. So we conduct the workshop in 3 parts, that is the part A, B and C. In the A, we have all 3 days where we teach the injectables like the botulinum toxin, the fillers, the PRP, vampire facial, lip filler, moles and tag removal, everything is covered in part A. Then in the part B, we do the semi-permanent makeup, that is the eyebrow mapping. Those who have very thin and sparse eyebrows can be given permanent eyebrows by microblading or by ombre brows or by powder brows, which is all taught in during this 2-day workshop of part B. Then there is also lip color camouflage. Many patients come to you for the smoky lips, where you cannot treat the patients for the dark lips, because a dentist is never taught how to cure the dark color lips of the lips. So there again, you have a treatment like you have neutralizers, you have illuminizer, you have colorants. So those can be put in the step-by-step manner to give the beautiful natural color to the lips. And then there is scalp pigmentation, that is the patients who have very thin hair, in both in males and females, can be camouflaged by putting hair-like pigments in between their hair. So that gives a fuller kind of appearance. The same way that like the biofiber does. Biofiber is artificial fibers which people spray before going to a function, before going to any wedding or any event. They tend to spray those biofiber. But the major drawback of that biofiber is it is temporary. Second, it tends to wash off in case the patient has gone in a rainy area, or if the patient is sweating a lot. So that tends to spoil your clothes also. So this scalp pigmentation is a beautiful way to camouflage your thinning hair. Then in the part C, we have all the skin types. What are the types of skin types? What are the skin products? You should refer to a client according to the skin type, like which sunscreen should be used, which vitamin C should be used. So all this is taught in the part C. Apart from that, all types of lasers and medical facials like hydrofacial, photofacial, vampire facial, all those facials and medical facials and lasers are taught in the part C. So that is how it is formulated, part A, part B and part C. And all this course that is also known as the Mastership in Facial Aesthetics. This is affiliated to the University of Messina, Europe. And this course is also conducted with me with the help of my friend, Dr. Chandni, who is MD dermatologist. So she's always there with me in this course to help out the participants from the dermat point of view. Then the next batch after this, because we could not accommodate many of the participants during the June batch, because we restrict ourselves to our people, 10 to 12 people only. So this batch already got filled. So our next batch is from 12th to 18th of August. We can celebrate the Independence Day by learning the new things together. I would be most happy to help you in learning all these procedures. And anyone who is interested for this workshop can directly contact me on the WhatsApp number given here. Then apart from the workshops in the all over India which we are conducting, we have an international mastership in facial aesthetics from Italy, where we take every year one batch of 10 to 12 participants to Italy. And this time this batch is going to Naples, and already 4 or 5 people have registered, and we will be taking only 10 people. And this is a beautiful experience where you learn from the international mentors, and you learn by sitting in between the international students also. So that's a beautiful experience you are going to have. But for that, the basic thing is that you should be thorough in your basic injectables and the basic these thing procedures, that is the permanent makeup of the eyebrows and whatever all these ABC parts, you should be all thorough in that. If you have done from our institute, you will get additional discount for going there. And if you have done from somebody else, from some other institute or some other mentors, then also if you have the certificates with you can show us the certificates, then that discount will be applicable to you also. And then these are our international mentors: Dr. Antonio, who is a plastic surgeon, then Stefania, who is a master in dermapigmentation, then Dr. Mario Giorgia, who is also a plastic surgeon. So all of us together, we have a group, international group, where we teach all these facial aesthetic procedures. Then this is the program which is there, day 1, 2, 3. 1 and 2 will be permanent makeup in detail, in advanced thing, and then the 3 will be about those procedures which we normally do not teach here to the dentist. That is the blepharoplasty, the upper eye anatomy, the patient consultation, evaluation, so many things which are not taught here anywhere to the dentist. Then day 4, we have advanced hair transplant. Those who have done a hair transplant from us in India, they must be knowing that while doing hair transplant, we first try to shave off the area, shave off the head. So we take out the follicles and then we put the follicles in the other area. That's how the hair transplant goes. But in Europe, what they are coming up with is that they transplant the long hair. Here we ask the patient not to get the hair transplant done if he or she is getting married earlier, like if he or she has to get any event, any important event in the coming days, then we tell them not to go for the hair transplant procedure for some months, because the result comes in 6 to 8 months. But there they prefer to go for the long hair transplant, where they are transplanting the long hair from one area to the another area. Then there are various other advanced indications like the liposuction and one-day tour is also there. So there are lots and lots of things to learn internationally also. So you're most welcome to have any queries for the international mastership in facial aesthetics. And thank you so much for your patient listening. Now, any questions are most welcome. Please let me know if there are any questions, Dr. Liwanshi.
Yes, ma'am. Dr. Ekta is asking about the fee structure, and Dr. Manisha also.
Fee structure of the hair in Delhi program or
Delhi.
Delhi?
Yes.
Part A, part B, part C. So individual part, if somebody wants to do, if you want to do part A, that is 35,000, part B is 35,000, part C is 35,000. So combined, it gives you 1.05, 1,05,000. But in case if you want to enroll for the complete course, that is the 7-day course, then there is a discount of 20,000. That is the net fees is 85,000. And we have some internship programs also. So once you are interested, we'll give you in detail the fees of the internship program also.
Dr. Manisha is asking about will the workshop include proper hands-on?
Yes, that is the beauty of our courses. That is why our courses are always full on. We give you a patient for each indication, like each procedure. If you are teaching you Botox, we will give you proper hands-on for the Botox. We'll be giving you patients for that. For fillers also, we'll be providing you patients. So for all these procedures, the thread lifting, the permanent makeup, you will be getting a patient. Anything else?
Anyone is having doubt?
So either the things were too clear or the things were too messy that the people could not get into their mind, so that they do not have any problem. Any master class for advanced injectables? Yes, we do have master classes also. We'll keep you informing. You just drop a message on my WhatsApp. I'll inform you for those. We have one-on-one sessions also. If any doctor wants to learn in one-on-one session, doesn't want to learn in a group, we have that provision also. So we can teach you the advanced mastership, advanced courses in injectables again in the one-on-one basis.
Ma'am, what about the pricing for the Italian course? Dr. Meena is asking.
That is 1.5 lakh, but for the alumni, it is 1.25.
Okay.
Yeah. Any other question?
Dr. Sun is asking, ma'am, what should we do for the large facial pores?
Large facial pores. So for the facial pores, we have various techniques. First of all is if you want to go for the fillers, then you can inject a very thin filler that is known as the skin boosters or volite. So you can inject very superficially into the dermal layer those fillers. But instead of that, before injecting the fillers, I would prefer to go for various other options like micro needling works very best, very good. It gives excellent results in pores. So you can always prescribe the patient at least 4 to 5 or 6 sittings of the derma roller or the microneedling with the derma pen. And after 6 to 7 sessions, your body will start producing collagen. And as more collagen is produced, the pore size will start reducing. And along with the microneedling, you can also prescribe the PRP sessions each month. You can give 4 to 5 sessions, one session in each month, and that gives beautiful results in the pore size reduction. And after the size has reduced, then you can counsel the patient for the fillers. Tell me any other question?
Please unmute yourselves and talk about your doubts. Ma'am, Dr. Zaki is saying any chance for course in Mumbai?
Mumbai, we were planning, we might conduct, might not conduct, I'm not sure. Maybe in August or September, we might plan. Because see, here in my institute, we have full number of patients, and I have all the machines here to show you, to display. Everything is here with me in the Delhi center. But outside Delhi, it becomes difficult for me because there we have limitation. We have the limitation for the number of patients also, because I am also sometimes new to that area. So the number of patients, how to convince that patient for the particular treatment sometimes becomes difficult. So the number of hands-on becomes decreased for me, for the clients, for you people to practice. Plus there are no lasers, no medical facials which I can show you as much as I can show you in my Delhi center. We keep on conducting the workshops, but we conduct it only for the permanent makeup and only for the this thing injectables. That is part A, and part B we do. We have our next workshop in Jaipur in the first week of July. Then we have in the second week we have in Jammu, and in the last week we have in Chandigarh of July. So we keep on conducting outside also, but most of the workshops outside Delhi, we do only part A or part B.
Which filler is used for the chickenpox scars?
Chickenpox scars, that again is like pores. So again, we use very thin fillers like skin boosters or volite.
Okay. Dr. Meena is asking about the duration of the course.
Duration of my course is just 7 days. In case you want to avail you want to have more practice, then we have a 3 weeks internship also. So you can go for that also.
And Dr. Sunny is asking about the ma'am, local anesthesia is needed for the botox and fillers.
I just discussed it few minutes back also, that local anesthesia, only topical anesthesia can be given, but I do not prefer to give injectable anesthesia because that makes the area complete numb. And in case your filler is going into any vessel and that is going to bring any problem to the patient, so the patient will not complain you, and then you can land up in trouble. So preferably, I do not give any anesthesia.
And in botox also?
Botox also. I never give in anesthesia. It is not required actually, because
Okay.
we inject the Botox with insulin syringes, and insulin syringe has a very thin gauge, like 32 gauge, 33 gauge. So that is not very painful.
Yeah, ma'am. Dr. Zaki is asking about the how to identify allergy to gram positive bacteria proteins.
See, if a patient is allergic to something, the patient will be most probably knowing it, and the patient will give you history. And normally we do not do any patch test because this material itself is very expensive and it is obtained from the bacteria only. So those bacteria are natural products. So these natural products rarely have any hypersensitivity, and there is rarely any article present on the hypersensitivity. Very few articles on the hypersensitivity form. So there are very, very remote chances of hypersensitivity. So if it happens, then you have to give the proper allergy medicines, which we give during the dental treatments also. It has to be treated the same way.
And which is the best for pigmentation?
Best
Best
treatment
for
for
pigmentation.
pigmentation, you meant?
Yeah.
There has to be a holistic approach to treating the pigmentation, because pigmentation is one such thing which is usually not curable, So you have to see whether it is epidermal or dermal. If it is epidermal, then you can treat it with the peels. If it is dermal, then you have to treat it with other products like glutathione or tranexamic acid. You have to give it for eating, or you can use the Q-switch lasers. So there is a plethora of treatments which you can give for the pigmentation, and it is all a hit and trial. You have to mix and match a variety of treatments to treat pigmentation. Glutathione injections can also be given, glutathione tablets can also be given. So there is again a plethora of treatments.
And what can we do for the sun tanning?
Sun tanning, definitely you have to prevent sun tanning by putting a thick layer of sunscreen before moving out in the sun. That is the first thing you have to tell your patients, that apply a thick layer. Do not apply dab, dab, dab. You apply it like a paste and let it absorb there, be absorbed there for at least 15 minutes before you move out in the sun. And it has to be repeated every 2 to 3 hours, especially if it is a physical sunscreen. If it is a chemical sunscreen, it can last for around 3 to 4 hours minimum. And if it is a physical sunscreen, that will last to 2 to 3 hours or 2.5 hours.
Dr. Chaya is asking about the what is the fee for one-on-one course and duration?
One-on-one course, you can always contact me on the WhatsApp. I will share with you the details. I will have to see, I will have to customize your treatment. How many days can you spare? How many patients you want to do, and how many topics you want to see. So accordingly, the fees can be customized, but you can send me a WhatsApp regarding your needs. I will tell you accordingly.
Okay. And Dr. Manisha is asking about the any after course support from our side, from your side.
Yes, I would advise you, or rather ask if there is any alumni who is present in this webinar. Anybody who has done a course from me? Anyone who is present here who has done a course? No one is there.
I am.
I can't believe this. Dr. Neelam is there.
And me also, yes, Dr. Neelam Verma.
So can you please throw some light on the post-course assistance?
Yes, ma'am, it's very fabulous.
Thank you so much. So the post-course assistance is always there. We have a WhatsApp group, we have a Facebook group, and I'm always available on the call also if you have any emergency. You can always WhatsApp me your doubts, and by the end of the day, I make it sure that I reply to all the queries.
And Dr. Rishika is asking about the are BDS graduates eligible for these hands-on courses or only the MDS?
How could this webinar be completed without this question? Because every webinar has this question. So being a dentist, you are allowed to perform these procedures, though there are no written guidelines. But recently the DCI has allowed all the oral surgeons to perform all these aesthetic procedures in this area. And whatever a thing is allowed to the oral surgeon is allowed to the general dentist also. An oral surgeon is allowed to do implants, you are also allowed to do implants. An oral surgeon does extractions, you are also allowed to do extractions. So it's like you can do, but it should not be, there are few things which are not allowed. So those are there. I will tell you in the course that these things should not be done by the general dentist. So there are few things. So like we do not want to display ourselves as twacha rog visheshagya or the skin diseases specialist. We are not here to treat the skin diseases. We are not here to write ourselves at the hair specialist, the skin specialist, or the nail specialist, because we are just aestheticians. We are cosmetologists. We are aestheticians. We are here to beautify you. If a patient is coming to me for psoriasis, I will not treat any, I will not write any medicine. If the patient is coming to me for eczema, I will not write any medicine, though I might not be knowing the medicine. But why to land up in troubles? With due respect to the dermat friends, let their field be independent. So we do not want to encroach into their field by writing their medicines on our prescription. So all these are, you have to follow some guidelines that we have not to encroach upon their fields. So you have to set a boundary.
Any doubts, anyone?
Would be a pleasure if you can all switch on the video for a minute and let me take a screenshot. If you people can just show your faces for a minute. Not willing, most of them? No problem, we'll take the screenshot with the names only. Thank you so much for attending this webinar today.
And one question is there.
Yeah.
What about the double chin problems?
Double chin can be treated with this thing. You have again multiple treatments. We have this deoxycholic acid injection. That is the lipolytic injection. There are two types of lipolytic agents. That is the deoxycholic acid and PPT. That is the phosphatidylcholine. So two types of injections are there, but they are not FDA approved. But they are ready-made injections which have to be given here. Like you have to make a grid, cross grid, and then you have to with the insulin syringe you have to go deep into that area, taking care not to inject into the mandibular marginal artery. So you just have to avoid this area, and then you can give 4 to 5 sessions of that, and then you can, after that you can inject mono threads in this area. So that helps in the reduction of the double chin. Any other question?
Any other doubts? I think everyone is clear, ma'am.
Thank you so much. Thank you, Liwanshi, for hosting such a
Mention not to mention.
organized webinar. Thank you. Thank you, everyone, for being there.
Thank you. Ma'am, yeah, one more question.
Yes, yes,
Ma'am,
yes.
please tell about your institute so that someone can join.
Yeah, we have Aesthetic Institute of India here in Shalimar Bagh, which is a 7-chaired center. So we conduct a workshop of 7 days almost every month. Next month we are not conducting in Delhi because we are already pre-scheduled for Jaipur, Jammu and Chandigarh. So in the beginning of August, like in the mid-August, we are again having a workshop here. So where we teach you all the aesthetic procedures, and sometimes we have the dental courses also. That is a 1 month procedure, 1 month workshop, you can say. And this is all about my institute. You're most welcome to visit anyone any day. You are most most welcome to have a cup of coffee with me anytime.
Thank you so much, ma'am.
Thank you. Thank you, Liwanshi. Thank you, everyone. Okay, bye bye. Take care.